Interviewing, when emotions become causes of disease too. The spiritual axis. In chapter 8 clearly illustrates the reciprocal relationship between the emotions and the internal organs. It says, the heart's fear, anxiety, and pensiveness injure the mind. The spleen's worry injures the intellect. The liver's sadness and shock injure the ethereal soul. The lungs' excessive joy injures the corporeal soul. The kidney's anger injures the willpower. On the other hand, further on it says, if liver blood is deficient, there is fear. If it is in excess, there is anger. If heart chi is deficient, there is sadness. If it is in excess, there is manic behavior. These two passages clearly show that, on the one hand, emotional stress injures the internal organs, and on the other hand, disharmony of the internal organs causes emotional imbalance. The emotions taken into consideration in Chinese medicine have varied over the years. From a five-element perspective, the Yellow Emperor's Classic considered five emotions, each one affecting a specific yin organ. Number one, anger affecting the liver. Number two, joy affecting the heart. Number three, pensiveness affecting the spleen. Number four, worry affecting the lungs. And number five, fear affecting the kidneys. However, these are not by any means the only emotions discussed in the Yellow Emperor's Classic. In other passages, sadness and shock are added, giving seven emotions. Number one, anger affecting the liver. Number two, joy affecting the heart. Number three, worry affecting the lungs and spleen. Number four, pensiveness affecting the spleen. Number five, sadness affecting the lungs and the heart. Number six, fear affecting the kidneys. And number seven, shock affecting the kidneys and heart. Other doctors considered other emotions, such as grief, love, hatred, and desire. Finally, and interestingly, there is one last emotion which is not usually mentioned in Chinese medicine, and that is guilt. Yet, in my opinion, guilt is very pervasive in Western patients and definitely an emotional cause of disease. Thus, the list of emotions could be expanded as follows. Number one, anger and frustration and resentment affecting the liver. Number two, joy affecting the heart. Number three, worry affecting the lungs and spleen. Number four, pensiveness affecting the spleen. Number five, sadness and grief affecting the lungs. Number six, fear affecting the kidneys. Number seven, shock affecting the kidneys and heart. Number eight, love affecting the heart. Number nine, hatred affecting the heart and liver. Number 10, craving affecting the heart. Number 11, guilt affecting the kidneys and heart. Thank you for your attention.